Okay, so we were discussing cardiac failure. Okay, so what's cardiac failure? It's also called heart failure. Yeah, what happened? Sorry. Okay, so hello everyone. So today we will be discussing cardiac failure. It's also called heart failure. Okay, heart or cardiac. It's the same thing. Okay, so today we'll be discussing. So what's the heart do actually? Its function is contraction. It contracts and it supplies blood to all the body tissues and all the body organs. So if the heart contraction ability decreases, like normally it contracts. So what will happen? Your blood supply to all the tissue and your blood supply to the whole body, and your especially the coronary circulation will be disturbed. So it will cause a vicious circle, and it will more decrease the contraction ability. So it's called cardiac failure. What's called heart cardiac failure? Decreasing contraction ability of the heart is called cardiac failure, and it is because of different reasons. And those cardiac problems or those cardiac condition would decrease the contraction ability of the heart. It may be because of coronary some abnormality, or it may be because of myocardial abnormality or pericardium abnormality. So it may be due to other body abnormality. Decrease in peripheral tissue resistance may be due to because of or because of the brain, or because of the sympathetic and parasympathetic disruption and disturbance. So the cardiac failure is caused by many factors. In this chapter, we will be discussing only the coronary due to ischemic heart diseases, like if there is MI or other coronary disruption. So in this, we will be discussing that in detail. Okay, so let's go in detail. One of the most, okay, I will highlight one of the most important element treated by the physician is cardiac. Of course, if a physician treated cardiac failure, it's what's the important. This element can result from any heart condition. They reduce the ability of the heart to pump enough blood to meet the body's need. The normal cardiac output is 5 liter per minute. So if the cardiac output is decreased, so what will happen? Your normal blood supply that your body need will be decreases, and it will decrease overall blood supply. uh, and what's caused the cardiac output? Because of cardiac output is, let me say, cardiac output is because of what? Heart rate, the factor behind, and what? Heart rate, and what's the other? Stroke volume. These affect your cardiac output. So if your heart rate decreases, or your stroke volume is the volume of blood which is ejected per beat when your heart contract and systole. So this is your stroke volume. So if your stroke volume or your so if your stroke volume decreases, okay, or your heart rate decreases by some reason, like sympathetic disturbance or other reason, and your stroke volume decrease per beat, your heart is not pumping that much. Your normal stroke volume is how much? 70 ml per beat. So if it is decreases, and what causes a stroke volume? It's because of the force of contraction that of your heart flying your heart muscles. So if it decreases, so it will definitely decrease stroke volume, and your cardiac output will definitely and obviously it will be decreases. So let's say so let's go in detail. Okay, So the cause is usually decreased contraction ability microbes result of diminished coronary blood flow. This is the one. This is one cause. This is not. But this is the major cause of the your heart. What your heart. Your cardiac failure. Okay. However, failure can also be caused by damaged heart valves. If the I said earlier that if any heart condition that causes less contraction ability. So if any condition causes less contraction ability, this less contraction ability will due to cardiac failure, and it may be due to different reasons of your heart condition. Number one is damaged heart valve, like your AV valves. Okay, your AV valves damage occur, like these are incompetent and aortic regurgitation, semilunar valve. There is main problem in semilunar valve. Aortic valve stenosis occur, or AV wall stenosis, or AV wall regurgitation, mitral wall, tricuspid wall in the left and right side of the heart. So this will definitely what it will it will the heart, like for example in what in aortic wall stenosis, your your aortic wall is tipped. So your heart will do to compensate to maintain the blood cardiac output, it will contract with force. So if it contract with force, what will you do? Your heart muscle will hypertrophy, especially your left ventricle muscles, and this hypertrophy will what lead to decrease gradually with time. Your contraction ability of your heart will be decreases.